it's CJ. Are you pregnant and wondering if it's safe for you to take medications during your pregnancy? That is so understandable, and unfortunately, it is a decision that you have to make while you are busy creating this tiny human. Today I'm going to talk about medication use in pregnancy, the risks versus the benefits, and if you stick around, I will let you know what medications you should not take while you are pregnant. In the OB world, whenever we prescribe medication, I always try to make sure that the benefit to the product outweighs any risks associated with it. That being said, if you are having a totally normal, healthy, uncomplicated pregnancy and wish to avoid all medication use, you can do that. The only medication I would encourage you to take is your prenatal vitamin. Ideally, you want to take it every day. If you can't remember to take it every single day, that's okay too. Just try to take it most days. If you cannot tolerate the prenatal vitamin, you can't get past the smell, or it makes you queasy, it is okay to take an over-the-counter gummy. Just make sure that it has somewhere between 400 and 800 micrograms of folic acid in it. If you have a long-term health issue, such as high blood pressure, diabetes, if you have asthma or thyroid disease and your OB provider has recommended you take medication, understand that that medication will not hurt your baby and in fact will hopefully allow you to have a healthier pregnancy. If you have questions about the medications, please address those to your OB. I strongly recommend you take all medications as prescribed. If it has been determined that you are at increased risk to develop preeclampsia during your pregnancy, your provider may recommend that you take a low dose or a baby aspirin starting at 12 to 16 weeks. You want to take that medication every single day. A lot of people are very concerned about baby aspirin, thinking it might increase their risk for bleeding. Because it is such a low dose, studies have shown that it does not increase your risk for bleeding. Again, if you have questions or concerns about the baby aspirin, please direct those to your OB provider. There are other medications such as antibiotics, antidepressants, over-the-counter medications. Most of those have never been studied in pregnancy, but have also not been found to cause any harm. I do recommend you take those as prescribed as well. If you have a history of depression or anxiety and it goes untreated, that can actually increase your baby's risk for developmental delays later in life. If you have an infection, such as a UTI, that goes untreated, that can lead to preterm labor. As far as over-the-counter medications go, hopefully your provider has given you a list of pregnancy-friendly medications that you can take. So what medications should you not take while you are pregnant? Number 1, Accutane. That is a medication that is given for acne, and when you are put on it, you need to be on at least 2 forms of birth control. If you get pregnant while you are on Accutane, it can cause severe birth defects, so you need to stop taking that medication right away. Number 2, Methotrexate. That is a medication that is given that can cause you to have a miscarriage. So if you are pregnant and you have taken that, seek medical attention right away. Number 3 are statins, medications that help with your cholesterol. Again, those have been found to cause birth defects, so you need to stop taking those right away if you learn that you are pregnant. And number 4, you need to not have a rubella vaccination because that too can cause birth defects. So what questions do you have about medication use in pregnancy? I hope you'll leave those in the comment section below. And while you're in that comment section, I would also really appreciate it if you just go ahead and hit that like button.
You're still here. Thanks so much for sticking around through the entire video. If you feel as though this information has been helpful to you, or you think you know somebody that might benefit from the information provided in these videos, please feel free to like it, share it, and if you haven't already subscribed, I would love it if you did that. Any and all support that you can provide is so greatly appreciated. As always, these videos were not created as a replacement visit with your healthcare provider, rather as a place for you to come for basic, reliable information that is non-biased and hopefully allow you to figure out what questions to ask your healthcare provider at your next visit to best meet your healthcare needs. Again, I appreciate all of your support. If you want to contact me, my information is at the top of this screen, and I will put it in the comment section of this video. That's all I have for today. This is CJ. I'm at your cervix.